Health. At the doctor's office.
I'd like to see a doctor. I'd like to make an appointment to see Dr.
Do you have an appointment? Have you been to our office before? Have you been here before?
The doctor's ready to see you now.
Talk about symptoms.
What brings you in today? What are your symptoms?
How have you been feeling generally?
Report the disease.
I've been having headaches. I'm very congested. My joints are aching. I've got diarrhea. I've got a lump. I've got a swollen. I've got a swollen ankle. I'm in a lot of pain. I've got a pain in my back. I'm asthmatic. I'm diabetic. I'm epileptic. I'm having difficulty breathing. I've got very little energy. I've been feeling very tired.
I feel a sharp pain when I bend my knee. My neck is stiff and sore. I think I've pulled a muscle.
I've been feeling depressed. I've been having difficulty sleeping.
Medical examination.
Take your shirt off.
Could you roll up your sleeve?
Let me see your tongue. Bend your left arm. Put your hands on your hips.
Lie down on the couch.
I'm going to listen to your chest.
Go behind that screen. Roll up your left sleeves. I'm just going to test your reflexes.
Breathe deeply.
What hurts? Does it hurt when I push here?
How long have you been feeling like this?
Has the pain been getting better or worse? Do you smoke? Do you take any recreational drugs? Do you drink alcohol, and how often? Do you have a family history of this? How long has this been going on? Do you take any medicines or supplements? Are you sexually active? Have you had any previous surgeries?
Have you been treated for this before?
Have you seen a doctor about this before?
Have you been eating properly?
Have you been sleeping properly?
When did you last visit your doctor?
Do you do any exercise?
Have you been working hard?
I'm going to take your blood pressure. I'm going to take your temperature. I'm going to take your pulse. Your blood pressure's normal. Your blood pressure's rather high. Your blood pressure's very high. Your temperature's a little high. Your temperature's very high.
Treatment and advice.
We'll need to run some tests.
You're going to need a few stitches. I'm going to give you an injection. We need to take a urine sample. We need to take a blood sample. You need to have a blood test. I want to send you for an X-ray. You should stop smoking. How much alcohol do you drink a week? You should cut down on your drinking. You need to try and lose some weight.
Stay in bed for a few days.
I'd like to keep you here overnight for observation.
I want you to see a specialist.
We haven't made a diagnosis yet, but we've ruled out cancer. I'm going to prescribe you some antibiotics.
Are you allergic to any medicines?
I'm allergic to antibiotics.
Come back if it doesn't get better.
Keep taking the medicine.
Come back and see me next Tuesday.
The doctor's message.
Dr. Naveen's office is closed. It opens on Monday morning at 8:30 a.m. For emergencies, please call 1-866-555-0546. The office is open from 8:30 to 5:30, Monday to Friday. Please call Monday morning for an appointment. For directions to Dr. Naveen's office, please press 5.
Making a doctor's appointment.
Elena makes an appointment.
Good morning, Dr. Naveen's office.
Good morning, this is Elena Timkova.
How do you spell that, please?
Elena, E-L-E-N-A. Timkova, T-I-M-K-O-V-A.
What's wrong?
My daughter Olga is sick. She has a sore throat and a fever. Can we have an appointment?
The doctor can see Olga at 2:30 this afternoon.
Thank you. That's great.
We'll see you at 2:30. Don't forget your health card.
Making a doctor's appointment.
This is Dr. West's office. How may I help you?
I'd like to make an appointment.
Have you been to our office before?
No, I'm a new patient.
What's your name?
Maria Taylor.
May I have your phone number, please?
Yes, my number is 954-317-8770.
What are your symptoms?
Well, I have a sore throat, a cough, and a high temperature. I'm also very tired.
The earliest appointment I have is 2 p.m. on Thursday, May 7th. Can you make it then?
Yes, that's fine.
Please come 10 to 15 minutes early to fill out new patient forms. Do you need directions to our office?
No, I know where it is. So I'll see you on Thursday the 7th at 2 p.m.?
Yes, that's correct.
Thank you.
Making a doctor's appointment.
Hi, ABC Medical Center. How may I help you?
I'd like to make an appointment with Dr. Brown, please.
What's the issue with you?
My knee hurts. I've been running a lot more lately, and I think it is injured.
Dr. Brown has openings next week. Are you free on Wednesday or Thursday?
I'm free on Wednesday morning.
Okay, what's your name?
Maria Taylor.
Yes, sure, Ms. Taylor. We will schedule you for next week Wednesday at 10 a.m.
Thank you.
See you next week.
Changing an appointment time.
Good morning. I made an appointment with Dr. Smith, but I have to change it. Hi, I have a doctor's appointment scheduled with Dr. Smith, and I need to change it.
What day did you have it scheduled for?
My appointment was on Tuesday.
What time was it scheduled for?
It was for 2 o'clock in the afternoon.
I see your appointment. What day would you like to switch it to?
I would like to switch it to next Friday.
What time would you like?
I would like to come in at 10 in the morning.
Fine. I will pencil that in right now. We will see you then.
Taking an urine sample.
What is that plastic cup for?
Your doctor has requested a urine sample.
I'm supposed to pee into the cup?
We want what we call a clean sample. Urinate a drop or so into the toilet, and then stop the flow and urinate into the cup.
Then what do I do with the cup?
You put the cup in the little cubby in the restroom and close the door to the cubby.
What is this test for?
He is looking to see if you have a bladder or urinary tract infection.
When do I know the results?
Your doctor will call you in a few days with the results.
Taking X-ray.
I came here to get a chest x-ray.
I will need you to take your clothes off from the waist up and put on the gown, leaving the opening in the back.
What comes next?
I will need you to face this glass plate right over here.
Should I do anything else?
Your arms need to be raised to shoulder height.
Is this okay?
So far, so good.
How come you were walking away?
I am not leaving. I just need you to take a really deep breath, hold it, and then let it out.
Will I be finished then?
You will be able to put your clothes on as soon as I have checked the film.
Normal test results.
Hello, could you tell me my test results?
Your results are posted on the website. Just put in your password and you can see the exact numbers.
Are you saying that all my results were normal?
We always contact you by phone to come in if there is a need for follow-up.
How will I know what the results mean on the website?
The purpose of each test is given on the site.
Will the numbers mean anything to me?
The website will give you your results and then tell you what the normal range is.
Can I see all of my test results at once?
Yes, you can see every test for the past 5 years. You can compare them.
Going to an emergency room.
Sorry to bother you, but I was wondering if you could drive me to the emergency room.
Of course. What is the problem?
I am running a really high fever of 105 degrees and I have a rash on my stomach.
If you can, go and unlock the back door so I can get in when I get there if you fall asleep.
I can do that when I get off the phone.
Do you know where your driver's license and insurance card are?
I already had them out before I called you.
Where is your nearest emergency room?
It's just a few blocks away.
Fine, I'm on my way. I'll be there in about 5 minutes.
Going to an emergency room.
Doctor, can you give me some suggestions on how to stay healthy?
Well, first of all, you need to make sure that you eat the right foods.
What are the best foods to eat?
You should emphasize fresh fruits and vegetables, along with whole grains and protein.
What should I avoid?
You need to avoid highly fatty and greasy foods. You should also avoid too much sugar and caffeine.
What else is important to stay healthy?
You need to get plenty of exercise every day. If you smoke, you need to stop.
Is it okay to drink alcohol?
Actually, studies have shown that people who have 1/2 a glass of alcohol per day do better than those who don't drink.
I'd like to make an appointment with Dr. Brown, please.
Hi, ABC Medical Center. How may I help you?
I'd like to make an appointment with Dr. Brown, please.
What's the issue with you?
My knee hurts. I've been running a lot more lately, and I think it is injured.
Dr. Brown has openings next week. Are you free on Wednesday or Thursday?
I'm free on Wednesday morning.
Okay, what's your name?
Maria Taylor.
Yes, sure, Ms. Taylor. We will schedule you for next week Wednesday at 10 a.m.
Thank you.
See you next week.
I'm here to see Dr. Brown.
What's your name?
Maria Taylor.
What time is your appointment?
10 a.m.
Okay, I find your appointment. Have a seat in the waiting room. I'll call you when Dr. Brown is ready.
Thank you, and I think I have a fever.
Let me take your temperature. Okay, at this time the fever is 101 degree. Don't worry.
Thank you. Good morning, Dr. Brown.
Good morning, Maria. What's wrong with you?
I'm feeling unwell and having a slight fever and a sore throat.
How long have you had these symptoms?
2 days ago, but it's getting worse.
Are you taking any medication?
No.
Do you have any other symptoms?
I have a runny nose and can't stop sneezing. Also, I have a bad cough.
Did you vomit? Do you have diarrhea?
No, but I'm feeling really tired.
Let me examine you. Open your mouth wide and say ah. Let me listen to your lungs. Take deep breaths. It sounds like you've got the flu. I'm writing you the prescription and you can buy the medicine from the pharmacy.
Thank you.
The medicine will make you feel drowsy. You should have light food and drink lots of water. Also, you should get plenty of rest.
Okay, can I have a medical certificate?
Sure.
Thank you, Dr. Brown. I feel a pain in my shoulder.
Hi, what's the issue with you?
Hi, doctor. I feel a pain in my shoulder. I've been going to the gym a lot recently and I think my shoulder got injured.
When did the pain start? And does it still hurt now?
About a week ago. Yes, it still hurts.
Let me check. Could you raise your hand?
Ouch, it hurts.
I suggest you ice it and I'll prescribe you some pain medication. Take some rest and don't work out in the gym.
Thanks, doctor. Should I take the pills after meal or before meal?
Could I have your prescription, please?
Here you go.
So, here's your medicine. There are 4 different kinds of pills. For the white pills, take 1 pill a day. For the other pills, take a pill every 4 hours, 4 times a day in total.
Should I take the pills after meal or before meal?
After meals.
Thank you.
Mr. White, the doctor is waiting for you.
Thank you.
Hello, Mr. White. What have you come in for today?
Hello, doctor. I'm feeling ill. I've got quite a bad cough, but I don't seem to have a fever.
I see. How long have you had these symptoms?
Just for a couple of days. First, I didn't take it seriously. But yesterday my situation got worse. I started to feel chest pain.
Are you having any other problems except coughing and chest pain?
I feel myself very tired. And also I have terrible headache.
Do you smoke?
Yes, I do.
Coming.
Sorry for interrupting, doctor. But, we really need you in the operation room. It is an emergency. Dr. Foster will examine your patient.
Mr. White, as you have heard, I need to attend the operation. My colleague will examine you right now. Could you please sit on the examine table?
Hello. I am Dr. Paul Foster. I will examine you. Nurse, what are the symptoms?
Mr. White suffers from coughing, chest pain and headache. The symptoms started a couple of days ago. And yesterday he felt worse. He is a smoker. And he is 28 years old.
Please open your mouth, Mr. White. He has quinsy. Could you roll up your left sleeve? I'd like to take your blood pressure. 120/80. That's fine. Please cough. Mr. White, we need your chest X-ray.
Okay, doctor.
Come in, please. Hello again, Mr. White.
Here is my X-ray, doctor.
Let me see, Mr. White, you suffer from flu. It may be because of the seasonal change. I'm going to give you a prescription for some medicine. You should take 3 times a day after the meals. Also, I am giving you vitamin pills to strengthen your immune system. Moreover, you should stay at home and have a rest for 3 days. I strongly recommend you to give up smoking.
Thank you, doctor.
Welcome, and get ready.
Hello, today we are at a hospital. Hope you will enjoy. I've been having a lot of headaches lately.
Have you just started getting a lot of headaches?
I never had very many headaches before, but the last few days I have been getting a lot of them.
Have you had any unusually stressful situations in your life lately?
I've been under stress, but no more than usual.
Have you been getting enough sleep lately?
It's been hard for me to sleep with a bad headache.
Have you bumped your head or fallen lately?
No, I haven't hit my head.
Let's have you come back in a few days and see how you feel. What brings you to here today?
I can't sleep, eat or think straight. My tooth is killing me.
How long has your tooth been bothering you?
It bothers me off and on, but it's gotten much worse these past few days.
Is there anything that you've done to your tooth that might have caused the pain?
I think one of my fillings might be coming loose.
What kind of toothbrush do you use?
I use a regular hard bristle toothbrush.
Does it bother you when you eat something really cold?
Yes, it definitely bothers me more when I do that.
You don't look so good.
My stomach is bothering me.
What have you been eating?
I had hamburger with ranch dressing for lunch.
Maybe the food had something wrong with it.
It could be bad food, but I didn't feel so well yesterday either.
Are you under a lot of stress?
No, I'm not. Things have been going okay.
I think you have caught that bug that is going around.
Yes, I may have caught a bug. Doctor, what is the best way to stay healthy?
You need to eat healthy foods and avoid unhealthy foods.
What are the best foods to eat?
You need plenty of fruits and vegetables, small amounts of protein, and whole grains.
What kind of food should I avoid?
You don't want to eat food that is high in fat. You need to avoid sugar as well.
What else is important to stay healthy?
You need to get 1 hour of exercise every day.
Thank you for all the tips, doctor. See you later. Hi, I'm Dr. Kate. Welcome to my clinic. Don't forget to repeat after us. Let's get started.
Good evening, doctor.
Hello, what's the matter?
I haven't been feeling well lately.
What exactly is the problem?
I have a terrible stomach ache. I also have headaches.
What's your appetite like?
It's not good. I don't feel like eating anything. I feel full all the time.
Are you taking any medicine at the moment?
No, I just took a painkiller last night. That's all.
Have you had any fever?
I feel feverish at the moment.
Let's have a look at your back.
I hope there's nothing serious.
You don't need to worry.
I don't think I'll be able to go to work tomorrow.
You should stay home and rest. You'll start to feel better in a few days.